Hello and welcome to our channel. Today we'll be talking about coronavirus or COVID-19. What is the situation right now? And we have an excellent article came out into one of the major public journals, and then we will be talking about it. So we'll cover 3 points: current situation on coronavirus pandemic in Italy, which got published 2 days ago, and what is the global situation at this point? What you can do to help out, personal level or social level. So let's get started and see if we can be prepared for this pandemic. As you would see, this is the link for JAMA-network.com, the JAMA paper, which stands for Journal of Medical Association. And this article, which just came out today, 2 days ago, and we are talking about it. We are desynthesizing this paper for you. If you pay attention to it, they have reported from Italy, which is the epicenter at this point for the whole pandemic, that they have roughly 22,500 patients with COVID-19 or coronavirus. Out of them, roughly 10%, 2,000 patients are healthcare workers, unfortunately, and 1,625 or roughly 1,700 patients have lost their life. That put them up to 7% of death rate or case fatality rate among the patients who are suffered from COVID-19 disease. They have bring this infographic by dividing them in age range, and if you see, like, roughly 35 to 37% are more than 70 years of age. That is a high risk population. Then another 37 to 35%, 35 to 37% is 50 to 70 years age. So above 50, that makes it roughly 75% of total infected patient in Italy, as a published report in this one. And then remaining 25 is made from patients from 19 to 50 years of age, and there was nobody from less than that age was suffered in there. If you break it down by gender, 60% male, mostly male predominant, and then 40% female. That could be the work situation as well. So that's why most males are being affected. Or at this point, we know that this is a 3-to-2 ratio in terms of male and female. I would like you to pay attention that roughly 75%, roughly 70% patients will either have no symptoms, unspecified symptoms, few symptoms, or mild symptoms. That makes it 7 out of 10 patients will have either no symptoms to mild level symptoms. They may not require hospitalization. They may not require to come and see a doctor. They can self-quarantine themselves. And remaining out of them, like 24, 25% will have severe symptoms, and 5% would be critically the patient we're talking about, who may require mechanical ventilation, who may require sepsis and shock treatment, who may require more aggressive therapies. That puts it like 0.5 out of every 10 patients who will have COVID disease. Just to give you perspective, that up to 7%. So people are getting infected, but they may not have major symptoms in there. In spite of that, we have to make sure that we are quarantining and we are having social distancing, and we have one slide on that as well. They break it down in terms of the age group, and if you focus, as patients start getting higher than 60 years of age, 70, 80, and 90, the percent case fatality rate, or the people dying because of the disease, went really, really high, from roughly 12, 13% to 23%. Overall, the death rate was, as I mentioned earlier, it was 7% reported, because there was zero death up to 29 or 30 years of age, and a few deaths as they go along. But it is a dose response curve. As age grows up, because of the chronic comorbidities and immune system, then more and more people died in that curve. Next, we're going to talk about what's the situation at pandemic level. This is a very beautiful infographic page, or informative page, was created by Johns Hopkins Hospital from Baltimore. It has been very informative. I'm following this one since its inception. You can also follow it. The link is right there. The 3 numbers you want to pay attention to. One is when it was last updated, and we can tell you it was last updated today on March 17th, a few minutes ago. And then if you say the total number of confirmed cases, this number by the time of recording this video could be up to 200,000. For the first time, the numbers is big. Third thing you want to pay attention to it, that roughly 80,000, 40% of these patients who are infected have been recovered. And then others from where the death rates are, how many people died in China and outside Italy, other places, and how many people are infected in each country. You have it. You can click it, and then you can go through with this piece of it. It talks about the daily increase of the case rates and fatality ratios and improvement as well. This is an important topic I want to talk about in the next few minutes. What you can do personally to fight this pandemic, protect yourself and your family members. First thing is hand washing. We as a healthcare community, as a physician scientist, as a healthcare providers, we cannot emphasize enough to have proper hand washing technique for 20 seconds each time. It doesn't have to be just before food or you use the restroom. It can be any time you come across in any strangers, when you touch any unknown subjects in terms of doorknobs or anything like a furniture as well. Please do frequent hand washing 4, 5, 6 times a day if needed as well. Pay attention to these areas. Some of these areas are not easily visible, or they could go unwashed. So something is inside the palm of these areas, the the space in between your thumb and your fingers, and space in between your fingers as well on the back side of your thumb. So make sure you're washing them properly and then doing hands as well. Use alcohol rub if you have it available, or use your soap and water for at least 20 seconds each time. We cannot emphasize enough. Second point I would like you to focus on: eat well, sleep well. And if your health allows you to exercise and you have means to do it within your apartment building, within your in your house, please do exercise as well. When I say eat well, what does it mean? That means please take nutritious food, which is high in protein, in fat, and carbohydrate, which keeps you healthy. Sleep well. At least 6 to 8 hours of sleep every night would be good for you. And if you exercise well, these things in combined will help you boost your immunity to fight with the virus. And if you contract the virus, then it may help you heal better or fight it against as well. And third thing I want to talk about is that unfortunately, if you fall sick, and remember, out of 10, 7 people will have mild to very small, no to mild symptoms, then cover your cough and sneezes. You can use your elbow and sneeze or cough into your elbow. Wash your hands immediately after sneezing and coughing. Make sure that your family members are away from you, and then they are also doing the same thing. And frequently clean for yourself or your family member anything like remote, keys, cell phone. These are three important areas I would like you to make sure that you're doing and then cleaning them as you go along. So remember, wash your hands, eat and sleep and exercise well, and stay at home if you're sick and your symptoms are not too dangerous or your symptoms are mild or unspecific. If you seek advice or seek help, please go to hospital, call 911, call your coronavirus 19 helpline, COVID-19 helpline, whatever your state or your city officials have asked you to do. So please follow the news, please follow all these updates and make sure that you take appropriate action. Socially, if you happen to go out in public, unknown people, first of all, you should avoid going to mall, going to movie halls, going to restaurants, or anything which you get exposed to more than 10 people, unknown people at a time. 6 feet is the social distance you want to maintain when you're outside, especially if somebody's sneezing or coughing. That means you're protected from those droplets. They might potentially have some of the coronavirus viruses in there. If you can avoid, absolutely do so. And I think if we are at this point now and we're saying this is tipping point that we need to put ourselves on self quarantine and making sure we are not doing it. And let me share one example. This was done by Washington Post. What they've looked into is they created a simulation environment to make us understand how self quarantine or social distancing help us out. So I'm going to just click on this link and show it to you quickly that how, if we take an example of a town which is let's say there are 200 citizens in that town, they are living in there. So if I go there and there's no social quarantine going on, there's no social distancing. So if you see, there's one infected person, and very quickly that one become 2, 4, 10, 20, 30, and very quickly almost everybody is going to be affected as they're getting in touch with each of these infected people. And if you follow this graph, which is a brown in color, that kind of tells you the surge capacity or their capacity to handle patients in hospital. People are recovering as well, but at the end of the day, almost everybody, 190, 180 people are infected. It'll take a while for this number to goes down. That means your hospitals will be at high capacity and maybe over capacity. Now take the second example. The same situation, same town with the 200 people, and there is a forced quarantine like China did it. So if you follow the quarantine, people who are sick, they are being quarantined, but eventually you have to live the quarantine. Some of these people will get out knowingly, unknowingly, and what's going to happen is that very quickly they start getting intermingling with healthy people, number will goes up, and where instead of 180, there'll be few people up to 60, 70, 80, 90, 120 people will get infected. But now quickly people start becoming healthier, and then this number will go down, but still the capacity will be higher, and then the hospital will be a little bit overwhelmed. In third situation, there is some social distancing going on, where what you're doing is you're doing social distancing on quarantine. So see that people are not moving, not everybody is moving. Then the people are getting infected, but the burden on the hospitals and healthcare system is not too high, as you will notice. People are recovering as well. This number goes high up to 60, 70, or 80, and then start coming down where more healthy people are there than sick people. Not everybody gets sick. People are staying there, not infecting anybody. And then as people are coming down, then they don't spread. If you put down at least 1/4 of the population doesn't move, even a little bit more social distancing, and see how it happens. People are staying there. Not very many people are, at any given time, only 25% are moving in the population. There are some sick people, other people are getting sick, but they're not going too high. Mostly this number goes up to, I think, 20 or 40 out of 200, instead of remembering the first simulation where you would have roughly quite a few of them as well. So today, with this, I will be ending our simulation, and let's see if we can talk about what we've learned so far. What we learn is wash your hands, eat well, sleep well, and exercise well. And make sure if you're sick, then make sure that you are staying at home and helping out, not getting people sick as well, and then stay healthy. So hope you like this video. We would like to see if we can produce more videos, and then if you like it, please do share and then subscribe to our channel, and we'll be happy to record more. Thank you so much for watching.